launch this conference that we have today, very special. So I will just get right into it here. I do want to mention, just before we go through the question, that in all 3 years that we had available to us for prep, we only had one question that was pertinent to the talk we're having today, which just highlights the disparity in having education on LGBTQ concerns. So I'll give you guys a moment to read this question, and then we'll go through some pearls. So we tried to set this up how our chiefs have been running our review sessions a little bit. So kind of picking out some of the terms that stand out. 12-year-old transgender girl, the mom's concerned that her child doesn't have any friends, and the question is asking you how she can support her child best. And so your alternative vignette could be, during a well check for a 12-year-old female, the mom expresses some concerns about how she can best support her transgender daughter, or the real question, what are the recommendations in counseling for this patient? So does anyone have any ideas about what the answer might be? Hey. Good job. Hey, good job. Yeah, so children who are transgender have an increased risk of depression and anxiety disorders.
So prep pearls, which are the things that our board preparation wants us to get out of each question. The main ones for this question, any adolescent, regardless of what they have going on, who does not identify specifically with their peers, is at risk for different psychological disorders and difficulties. As in this question, the transgender girl being at risk for depression. So the actual definition of gender dysphoria is marked difference between an individual's experienced gender and his or her natal sex. The difference must be present for at least 6 months and cause clinically significant distress to be actually described as gender dysphoria. And the actual guidelines on when to treat these children, the Endocrine Society put out clinical practice guidelines that recommend any transsexual person, the suppression of pubertal hormones starts when the adolescent first exhibits physical changes of puberty and not before. So I know one of the answer choices was to start treating them with that, and she was only 12. They didn't mention any signs of puberty, so she would have been too young to start with pubertal hormone suppression. Okay, and those are main pearls. This is the survey. We can put this back up at the end so that all the residents can fill this out.
And we'll introduce, we're really lucky to have some guest speakers today. So we have Callahan and Carole Becerra, who are going to talk with us about some of these disparities.
Well, thank you for having me. I don't have an extremely loud voice, and I also don't like podiums, so I move around. My name is Rebecca Callahan. I'm from CANAPI. We did put on your table our community report, so you can see a little bit about what CANAPI does.
Medical response team, main hospital, 6th floor, room 6214. Medical response team, main hospital, 6th floor, room 6214.
CANAPI stands for Community AIDS Network Akron Pride Initiative. And our focus more on our Akron Pride Initiative today, but just so you know, we do have other services that largely target HIV prevention and assisting those living with HIV. Also, little rack card for you to look at and see some of the things. Our website has a resource page. If you are interested or want to know where there might be a support group for any of your parents or your children to see, and then also some safe and LGBT affirmative counseling resources, which we do have some locally, which is fantastic to have that. So I guess I could talk, forever about CANAPI, but we're here to talk a little bit about the LGBTQ, QIAAPP community. A lot of people just say LGBT. Some people say LGBTQ. A lot of that I think is generational. Older individuals tend to say LGBT or even GLBT, and younger generations tend to throw in the Q and maybe even some more of the letters. It is an umbrella term. I tend to say Q because from my personal experience, my niece originally identified as questioning, and that was important to her, so I use Q. She now identifies as pansexual, which gets into those. Anyone have any questions about that alphabet and what does it mean and what is it significant? Is it not significant? I'm going to make this interactive. Hey, how are you? Good. How are you? Good. You're gonna have to tell them.
You get Skittles if you answer.
Yeah, there are some free Skittles.
We are eating the rainbow as well as learning about it.
Yes.
So I don't know any of the letters you said after the Q. What they stand for.
So lesbian, gay, bisexual,
Yeah.
transgender, questioning, or queer. And that's another generational thing. Well, queer, isn't that derogatory? Youth have reclaimed that, and I said, no, this is who I am. And queer tends to encompass really all things that are not non-heterosexual or non-gender conforming. So a lot of it is up to the individual. And I think one of the things when you're working with patients or parents to think about, one, we really need to think about the language that we use. But also, don't be afraid to show your ignorance. Ask questions that aren't judgmental, and people appreciate that. I appreciate it if someone asks me a question about myself and they don't make assumptions. So, people are people, and just keep that in mind. So, questioning, some people stick to questioning, particularly, and I find this with more youth today. I don't want to apply a label yet. Don't give me a label. I'm just going to live my life, and I'm going to love who I want to love, and I'm going to be with who I want to be with, and stop trying to put me in a box, which is really, I think, kind of awesome. And then intersex, I think as medical professionals, you probably understand intersex. Asexual, someone who is not interested in a sexual relationship necessarily. Being an ally, sometimes that's in the umbrella, sometimes it's not. I consider myself an ally, and I'm an ally because I like to speak up for those who maybe aren't able to speak up for themselves or not present to speak up for themselves. I speak out about equal rights and equity within our society, our community, and I'm an advocate, and that's what being an ally is, and being inclusive, making sure that you're looking out for those that may not be able to look out for themselves. Pansexual and then polysexual. Pansexual is with my niece, and she knows what I do, but she was like, I'm pansexual, and that is. I know that is, but that's good. She was, really excited to say, "This is who I am. See me," and that's really she's, as a 17-year-old defining that. She said, "I love everyone. I have the potential to have a spiritual, romantic, or sexual at that age." I did ask her, and she said no, but I was like, it's a valid question. It's a valid question about sex. Relationship, regardless of someone's gender or gender identity. And then polysexual kind of goes into bisexual or pansexual, or both forms of polysexual. And polysexual is just an attraction to more than one gender. Historically, bisexual individuals they've kind of had a rough time and get talked down to a little bit of why don't you just pick one, lesbian or gay, and I think that we've evolved through the decades that we don't necessarily fit into a neat little box of who we are attracted to, who we are interested in, or even who we are. So that's the polysexual. Some people don't like the bisexual label because there's some stigma attached to it, particularly within the LGBT community. The T, one thing to think about when we're talking about lesbian, gay, queer, questioning, we tend to be talking about orientation, and transgender is not about orientation. It's about gender identity. We don't want to make an assumption if someone identifies as trans that they're gay or they're straight based on whether it's they're male to female or M to F or F to M. Always ask. And I think particularly when you're talking about gender identity or even gender fluidity, many youth are more gender fluid or comfortable with saying that they're gender fluid than perhaps before, that you want to ask, particularly pronouns that can get. You guys ever go to a meeting where you say, hi, my name's Rebecca Callahan, my pronouns are she, her, and hers? That's, maybe it's just the world that I live in within the LGBT community, but it's becoming more and more common because you may not know and you don't want to offend someone, so just ask, what pronouns do you prefer? Someone may prefer the pronoun they. That takes, when I talk about our language, be careful about your pronouns unless you know for sure, and don't be afraid to ask. And some people aren't necessarily going to be a he and a her. They're going to be a they. And that, as someone who enjoys the English language, I have to get over my hurdle of that's not grammatically correct to say, well, okay, they. And use they. And it's difficult, but it's a change in our mindset of how we view others. We've, a lot of us, particularly my age, and that we've been told about these social roles and these social norms, and then so we can fit people in these neat little boxes. Well, now we have to change the way that we think because we want to make sure that we're including everyone in all aspects and not excluding someone from the conversation. And when we don't use someone's pronouns that they may prefer or they identify with, then that can exclude them. And that's, in the medical professional field, you want to develop that rapport with your patients or with the family members. So, so I'm trying to, some things asked for me to go over, and I don't want to step on Carole, although I told Carole to jump in at any time.
I know, I'm going to continue the conversation about pronouns, so we'll get
Good,
back to that.
okay. Because they can be a little tricky, yeah. But also, when I say we're talking about language and you're working with your patients, particularly youth, and I have this experience primarily, intimate experience from my niece, they're going to see if you catch on and see what your response is to it, or reaction. Hopefully it's a response and not a reaction. It's my niece a couple months ago. She met this girl, and they're kind of not dating, but she's interested in her, and and here I go with her because Kirsten was specifically saying Rose and using they pronouns, and I caught on to that. Kirsten, does Rose use they pronouns? Yes, and continued on, but see if I'm catching on to that. And then I had to consciously, and I work within this community, but I had to consciously try to make sure that I use the they pronouns at least a couple times in that conversation, because that also then lets her know I'm okay with that, and it might not even be about that issue, but particularly when it comes to youth, if they feel like you see them or you see who they are and what they might be about, they're more likely to come to you if there's an issue or a concern, because youth don't always want to speak up, but they really want to feel like they're seen. But one of the things that at CANAPI, we collaborate with Akron PFLAG, GLSEN, the UUC Church, with help from the Gay Community Endowment Fund for the Teen Pride Network. I put some of those cards on here. Feel free to take a couple. We got together and we probably 3 or 4 years ago, like, what do the youth have? Do they need a support group? Is that something that this area needs? And decided, well, there are support groups already out there. Let's do something to put on pro-social activities with LGBTQ youth and allies in the area. Trying to get teens, and it's age 14 to 17, to RSVP to things. We never know if we're going to get 5 kids or 50 kids, so there's always plenty of food. But we plan activities, like in December we go ice skating at the downtown Akron. We have we might have a Halloween dance, game nights. The church, UUC Church, lets us use those. Participate in any pride-related activities, things of that nature. What we found in a survey we did last year, that the youth are really looking for some leadership training, so we're trying to incorporate that in. But like TPN on Facebook, if there are events coming up, get to know it. If you think someone might like that kind of support of just some social activities to go and not be judged and be comfortable around other kids. And it's truly amazing that we've had kids from up to 6 different counties where parents will bring them in just so they can hang out with other kids and not worry about whether or not they look different or they're acting different. And it's amazing. And they all sing with the dances to know Bohemian Rhapsody by heart. It just amazes me. No, wait. But Teen Pride Network is a nice resource. The question was about transgender girl. Out Support Medina, which is on CANAPI's page, is a support group in Medina. It's a little bit of a drive, but Sandy started that support group probably 5-6 years ago for recognizing the need for her transgender son. And that support group has a lot of members that are transgender, and they're youth, and it's kind of a family support group, and they do different activities. So I would highly recommend that. There is a trans support group for adults here in Akron. That's also on our website. But if you're looking at, we get parents who are like, what do we have? What can I go to? And Out Support Medina, I would highly recommend it because they do a lot of family-centered activities. Let's see, homelessness. We do an LGBTQ youth homeless program. Our other housing programs are geared towards people living with HIV. The Gay Community Endowment Fund, or GCF, funded us last year, and hopefully I'll find out if they fund us again this year, and I think they will. There is a need for housing for LGBTQ youth. Unfortunately, I like to live in a world where everyone's open and welcoming, but I recognize that it's just not always the case. Kids are still getting kicked out of their homes for being gay, lesbian, pansexual, just not heterosexual, anything. And it's hard enough being homeless. I can't imagine being a youth. But for youth who are emancipated up to age 24, if they need assistance with first month's rent or security deposit, CANAPI does have that service. We also do like a go bag or get your apartment ready, a few $100s of items that they'll check off that they might need. The difficult thing are for youth that can't live independently. There is a street outreach service for youth, a drop-in center in Akron, and in talking to them, they estimate that 40 to 50% of the youth that come in there identify as LGBT or Q. 40 to 50% of the homeless youth, and there are a decent amount of homeless youth right here in Summit County identify as LGBT or Q. That's it's hard enough being a youth, and then trying to find yourself and identify yourself and not being welcome. So things to think about when you are seeing your patients about what the situation is. Homeless youth and LGBT youth in particular are more likely to turn to selling themselves for food or shelter, substance misuse, depression, isolation, being physically attacked. It's something to keep an eye out for. one of the things, I'm on the advisory committee for the Restore Corps. Are you guys familiar with the Restore Corps at Juvenile? Recently, they've been doing it for a few years, but they received accreditation. Judge Teodosio is doing a program for youth that get caught up in the criminal justice system to screen them and try to find which ones crimes are related to being trafficked and which ones are at risk for human trafficking. That's a really, it's a great program. Unfortunately, those youth have entered into the criminal justice system, but they can also get their records expunged by going through classes and things like that. So what questions do you have? I could probably talk about 100 different things, but any questions? I don't want to take up your time.
So one of the questions I always have whenever I'm using inclusive language in a medical setting with patients is I feel comfortable with it, especially when talking to patients that would identify with the LGBTQ community. I think that where I feel less comfortable is when patients have a strong reaction to me, like maybe asking about, and not making assumptions about their sexuality or not making assumptions about their gender expression. But like some maybe families that don't necessarily agree with that or feel like that's against their, and then I feel like I alienated, or they don't, so what, you think I'm gay? Like, you know, just because I'm trying hard not to be inclusive and so that's, I guess that's where I struggle.
Can you give me an example of what that sounds like?
Right, so like if I, so I'm a psychologist, so sometimes we would talk, like if I'm with an adolescent and we are talking about dating or, you know, when we talk about that, so I'll try very hard not to make assumptions that they're dating opposite sex partners. And so then I may ask them, you know, like, well, how do you identify? I usually don't say from, how do you identify in your sexuality, because I find families can sometimes, especially if parents are in the room, can respond strongly to that. So I was like, you know, and when you're thinking about dating and things like that, or relationships, and then oftentimes I'll have positive responses to patients who do identify as LGBTQ, but for patients that is they have strong opinions against the LGBTQ community, that's a strong reaction that, like, you think, what, you think I'm gay, or what are you, you know, that has, or I worry about that, or like if I think about using they versus he or she, I guess that's kind of where I started to have that question. I worry a little bit less, I guess, now about that, but changing to they.
I'm not a psychologist, but I think that when we start using language regularly within our cultures that are not necessarily gender specific or that are inclusive, then it's going to become more natural that I'm just using language that's inclusive of all my potential patients, and I'm not trying to say you are one or the other, but these are the questions that I ask.
That's absolutely right, yeah. So you want to make sure that the patient, the families, whomever is in the room, understands that you ask these questions to everybody, first of all, so you're not othering automatically, that you want to provide people the opportunity to identify themselves, and if need be, an apology goes a long way. Just say, I apologize, I will try to do better next time if you offend somebody, or if you don't ask the question. So that's, you're on the right path.
Mm-hmm.
I have a question just for our residents. So when we thought about that initial question that we opened up with that might show up on your exam, you noticed that there was a lot of difference between what was described as gender expression and then she, her family, their. So I would just want to know, maybe for Skittles, how would you as residents navigate that conversation with the patient? So how would we maybe ask in a way that's effective in taking in what we're talking about today to ask that question to the patient about the pronoun that she prefers to use?
No one likes Skittles. That's it. No one likes them.
Okay, I'm going to jump in at this point. So first of all, this is a safe space. Everything that we talk about here is to learn. So there are no wrong answers, there are no silly answers. Anything that pops to your mind, blurt it out. So that may help with Dr. Lindsay's question.
I'm not a but I'm a psychologist as well. And the few patients that I've encountered, when I've met them, luckily enough, because we have access to previous records, I see your name, and you have to call by their name. If I see you go by something else, what would you prefer that we call you? And is it all, are they something they gave me, it was a male to female, would you like me to call you Sally or whatever? Would you like me to refer to you as she? Would that make you more comfortable or something along those lines? And it was very sort of, sure, yeah, okay. And that was kind of that. Where we ran into a challenge was Dad used different pronouns than she did, and I felt very awkward because I was using the pronouns that she had requested, and Dad was not.
Respect and dignity.
And it's always, depending on the age of the child and the situation, you're treating the child, not the family. So you want to respect the child for who they are, where they're showing up today. So you did a really good job with that.
I love seeing this.
Yeah. I saw another resident hand too in the very back. Yeah.
Yeah, I just feel like most cases are pretty quick to tell you how it is. Like, if with this specifically, I've really come across that a couple times, and I usually enter the room and say, like, is this so-and-so? And then actually I go by, like, all right, sounds good. And then we pass it around with, like, each sign out so we don't make that mistake again.
That's excellent. Yeah, people shouldn't have to continue to introduce themselves. So one thing that, actually, I'm going to back up so I can do this respectfully. Hi, I'm Carol, and I prefer the pronoun she, her, and her, and my preferred name is Carol. So the more you do it, the more natural it becomes. So if you were to ask my daughter yesterday, she'd say, my name is Emma, but I prefer Princess. So again, let the child identify themselves where they are in that moment. So I have a really quick activity just to do a little bit of an activity with using pronouns. I want a brave person to introduce yourself with your preferred pronouns and then talk about your best friend without using their name or their pronouns. Anybody brave enough to do that? Or we could just start with introducing yourself with your preferred pronouns and preferred name. And again, I have a mad amount of Skittles up here. And I will, thank you, because I will chuck them. I've got a good arm. All right.
I can do the best friend thing as well. Billy and fellow. Hello, my name is Billy, and I prefer he, him,
And his.
and his. Thank you. I had the same best friend for 14 years. My best friend is pretty cool. We both ran track together. My best friend is from Florida, so am I. Go Gators.
Right on. Great job, great job. Anybody else want to introduce themselves? Thank you very much. So talking about pronouns, and Rebecca had touched upon this, it's very important for identity, not only with LGBTQ plus members, but anyone. Another thing, I'm a Montessori kid, so from kindergarten until 8th grade, I called all of my teachers by their first name. It was very difficult for me to transition to high school and say, oh, hi, Mrs. Jones. I'm so used to saying, hey, Susie, and realized that there was a level of disrespect there. And again, it was because of my acculturation. So again, being able to introduce yourself and have others introduce themselves level sets. There are some individuals that prefer to go by their professional titles. Some just want to be Susie. So again, it's very respectful to ask anybody and everybody what their name is, what their preferred name is, and if they have preferred pronouns. And again, try your best to acknowledge and accept and respect the individuals. If you do make a mistake, it's okay to move on. So, sex versus gender. Often we use them interchangeably, so I just wanted to put some very basic definitions up just for clarity for this presentation and moving forward. So, for sex, it refers to the biological and physiological characteristics that define human beings. And gender refers to the socially constructed roles, behaviors, activities, and attributes that a given society considers appropriate for men and women. So for quick reference, gender's in your head, sex is down below. And I have this really great definition of gender from a kid that was in a PFLAG meeting I was in 2 months ago, and I just want to share it with you. He is 15 years old, and I thought this was so mature for a 15-year-old that I had to write it down. Gender is like the colors in a prism. It is full of a spectrum of amazing colors. Gender has nothing to do with who an individual is romantically attracted to. It does not always align with the individual's chromosomes or anatomy. Gender is how we perceive others. It is not necessarily the image that the outside world sees, but our own personal sense of self. I thought that understanding of self is so profound for a 15-year-old to be able to say that. And I was like, did you get that off the internet? He's like, no, I'm offended. You can ask me that. So again, we have to meet the people where they are. So how do we see gender? The concept of gender is everywhere. It's how we carry ourselves, how we interact with one another, and what we wear and how we wear it. So I'm going to do another activity. Again, I've got Skittles up here, people. I want you to give me some traditional gender stereotypes. So adjectives or attributes that go with feminine and masculine. So when you think of a girl, or somebody that's feminine, or you think of a man, or somebody that's masculine, what bubbles up in your head?
Females are.
I don't need any additional skills.
Okay.
But for, I guess, women are feminine, I might think of pretty, or men are masculine, I may think of strong.
Anybody else? Yes?
Nurturing for feminine or women and tough for men.
Anybody else?
I think when we think of toys, like little boys like trucks and rough and tumble, little girls are delicate and Barbies.
Absolutely. And again, it's how our culture has set us up as adults now to think of those things. So here's some others that come up when you think of traditional stereotypes for feminine and masculine. But we have to deprogram ourselves and see this for every kid, every person that we meet with. And when you think of it that way, I know Target, the past couple months, has redesigned their toy section. So instead of pink and blue, it's just toys. And they're, I think for the holiday season, they're going to start putting pictures of kids just playing together with all the toys. So again, if a girl wants to play with a truck, go for it. If a boy wants a Barbie, go for it. Again, we're playing. They're toys, they're objects. So I'm going to ask a question. As far as sexual orientation. So all of these have to do with orientation, expression, gender, and all of those things that Rebecca had touched upon. So first is sexual orientation. This goes with the feelings to others that are romantic, attractive, or a sense of connectivity. For example, it's the LGBTQ, AAPAQQ alphabet that comes with what we traditionally think of sexual orientation and the alphabet. The next is gender identity. So with that, it's the individual's internal sense of self. It may be binary or non-conforming. The most important thing to remember that it's based on the individual and not anyone else. And that again is imperative when we're treating our kiddos, that it's how that child identifies in that moment. And also be very open and flexible that the child may say, I'm a boy today, but tomorrow I may be a girl. Tuesday I don't know what I'm gonna be, and be accepting of that. In America, we usually see the option of man or woman, but in other cultures, there are things as two-spirit, India, Hira, and Thailand is Keto East. I had an individual help me with that because I botched it every time. But what is really exciting that just happened on Sunday in California, that Governor Jerry Brown signed the Gender Recognition Act to make it easier for people to change their gender on state identification and birth certificates while establishing a non-binary designation. So that's pretty cool that this, again, it's real time. People in America are realizing that people don't fit into just one box any longer. And please stop me if you have any questions, comments, concerns, and I will not be offended.
I'm not sure what your guys' intake forms are like.
It's male and female.
Male and female.
Mhm.
And that's something that I think that needs to change to include others, not just to allow someone an option to be represented on a form, but also when you're looking at, I'm a nonprofit, we look at grants, and we need those kinds of things, and it's very difficult to get stats. How many people are you able to serve? Or if you're looking at your care and exit evaluations, are you having more positive or negative within a certain group or demographic, and maybe it has to do with that. So I think it's something that you could fight with the powers that be to try to.
I've been here 6 months, and that was week 3, powers that be fight, because Epic has a new set via their white paper that they released last year, that there is a set that you can put as far as demographics that covers the spectrum. So again, it's meeting the person where they are. So more to come on that, hopefully. Okay, the outward physical manifestation. Oh, my bad.
Just a kind of comment
Sorry.
on that. I would think from a medical perspective too, that we may want to have sex and gender, because if someone identifies gender as female, but sex is male, and all we see in the medical information is their gender identity is female, they're still going to have male biologic medical issues.
Absolutely.
And so both of them then will need to be identified, rather than just say eliminate male and female and leave it open. I think it needs to be at least 2 different types of things, because it can create medical problems.
Absolutely. So I have a story to share from a system up north that happened a couple of years ago. So individual comes into the emergency room with bleeding, what was considered to be rectal bleeding, presented themselves as a male, short haircut, jersey, heavier set gentleman. He was in the ED for 2.5 hours before he realized, oh, I should tell somebody that I had a hysterectomy 3 weeks ago. Again, the people in the ED saw the person present as Thomas, and Thomas came in with these symptoms, did not do internal check at that point, but it wasn't until Thomas realized, like, oh, yeah, I had my ovaries and uterus removed 2 weeks ago. That could cause the bleeding. So again, there is a lot of evidence to have both gender, sex, and anatomical at birth sex, because you could have those removals, but you still need to get a pap smear. You still need to have mammograms, or if it's a male to female, the testicular type of prostate exams, all of those things. So again, yes, absolutely, it's very important to have that readily identified. And then also for the patient to be able to say, you know, I may present this way, my chart says this, but I also want to include this part of my history. And it's allowing that safe space.
And that would help, I think, when you're looking at a chart and going in and talking to someone. One of my staff members she's a trans woman, and she's expressed, she went to a doctor, she had a, just an actual checkup for a while, and the doctor really wanted to give her a pap smear, and she kept trying to explain she hasn't had transitional surgery, not going to happen, and the doctor for some reason just couldn't wrap her head around, no, I don't need a pap smear. So those kinds of things are always, when you see that, get your mind open and say, okay, I have to think about other things and way to treat this patient.
I agree. So I'm going to do a little activity with you, then and now. Talk to me about this picture. What do you see?
Aristocratic men wearing wigs.
Aristocratic men wearing wigs. Long flowing robes. Right? That was the epitome of male. And between late 1500s to late 1700s. As opposed to today. Again, I'm being very stereotypical. I acknowledge that people wear what they're comfortable with, but when people think of male stereotypically in America, we think of this, correct? Again, it's a social construct of what is acceptable and what is normative. But again, it's a prism, like my little friend said. Rebecca also touched on these as far as gender nonconforming. So to the extent to which a person's identity, role, or expression differs from the cultural norms of people of a particular sex. Transgender is an umbrella term for anyone who identifies outside of the gender binary of male or female. And then the whole concept of gender dysphoria. So discomfort and distress that is caused by discrepancy between a person's gender identity and the person's assigned sex at birth. So with these three terms, other terms that you may hear is cisgender. Does anybody know what cisgender means?
Someone shaking their head.
It means your gender identity matches the sex that you are assigned to.
Absolutely. Transgender, again, it's an umbrella term. Gender fluid is another one I think Rebecca touched upon. Gender queer and agender. Again, all of these fall under the umbrella of gender nonconforming and transgender. So they can be used interchangeably when a person is identifying themselves in the moment that they're sitting in. So gender is less like this, it's male's female, and it's more like a whole bunch of things. And again, people identify the way they feel they want to identify. The next set of slides that I'm going to share with you, I need to preface that this is older data. It's ranging from 2009 to 2015, and they mostly follow adults because, again, being able to collect data on children is very difficult when it comes to gender expression, identity, and sexuality, but I think it's very important to share these numbers, and these numbers are growing. At the bottom, it says certain factors affect reporting in numbers. Is how the question is asked. So if it's asked with compassion and understanding versus spitting it at somebody, you put your defenses up, you may not be as honest as you ought to be. Where the question is asked, you should always ask these type of questions in private, or as private as possible, so not at a registration desk saying, okay, so are you girl or boy, are you man or woman, and what question is truly asking. Is this person being nosy, or are they doing it for an intentional reason? Okay.
So on that last slide, what do the colors on the map mean?
That is population density of some of the surveys that were taken of respondents. And again, this is from the Williams Institute. I can get more information about what each color means exactly. So I apologize for that.
I want to make a note about, well, we don't have a census in Summit County. I don't know if any of you are familiar with the Seymour study. They survey certain nonprofits. We can buy questions to try to get an idea if people know who we are, our mission, et cetera, things like that. CANAPI did that for the first time this last year, and we asked them to include gender identity and orientation in their demographics, because that's part of the population that we serve, and so we need to know those numbers, and they were great, and they did add those in. Interestingly enough, of the respondents, and the numbers are statistically significant for Summit County, we can estimate that Summit County's population is about 6% LGBT or Q, or maybe I don't know if we're more LGBT people or more people are out, but maybe because of our political climate, people are more willing to identify. But interesting nonetheless.
And to piggyback on that, there was a lot of debate going back and forth about the 2020 census that's coming up for the nation. The last I heard that gender identity and expression will not be counted. So again, that's something that's still up in the air. And very unfortunate, absolutely. So I know this is kind of fuzzy to read, but again, this is some different reports that were done both nationally and internationally of how individuals identify same-sex attraction behavior. Okay, the DSM change. I wanted to put this in here to show that the change just occurred in 2014. That was kind of horrific for me to find out. So I thought I'd put that in here as well. And to make note that not all trans people experience dysphoria. I think that's very key to remember. So mental health and substance abuse, again, Rebecca touched upon that in her presentation, but I wanted to put that in there just so you were aware. As well as suicide rates. So with suicide rates, based on studies, gay and bi males are 4 times likely to commit suicide, and lesbians and bisexual females are twice as likely to commit suicide than their heterosexual peers. It's hard to find information about suicide rates in adolescents and children, but there is a strong case of social media being used when a child may decide to take their own life for clues that their sexuality, their expression may be part of the reason they decided to make that decision. Discrimination against in public accommodations. I wanted to highlight a couple of them that denied equal treatment is the light blue, and the dark blue is harassed or disrespected. And then the top number is physical assault. So again, when you're looking at being in a doctor's office or hospital, on an ambulance or an EMT or a mental health clinic, this is what people are reporting out.
And this should be eye-opening for us as practitioners in a hospital setting, that the second highest was in an actual hospital. And that shows you just how much more we have to go.
So intervening in harassment. With my role in inclusion and diversity, I think all of these points are imperative, not just for LGBT situations, but also any type of harassment or discrimination. The last bullet point is hold aggressors accountable, and to know your organizational policy. And here at Akron Children's Hospital, it's organizational policy 5611. And harassment of any kind is prohibited. We encourage a culture where employees trust and respect one another, and we ought to put that before our patients as well.
Do we feel comfortable speaking up? At work or even in our personal lives when we hear hate speech, whether it's LGBT or otherwise? I think it's something to think about. Do I feel comfortable, and if I don't, why?
Also too, just as the role, as many of you in here are trainees, and how difficult that is, because oftentimes you, with youth, bring a lot of knowledge to the table. So you might even be in situations with your own supervisors or staff that are supervising you, where you could be put in a position of kind of calling them out, but still within your role as trainees. So that's kind of double difficult for a lot of you in here.
And with everything, when it comes to inclusion and diversity, we want to have that type of forum that it's a reciprocal relationship. So if you are put in that situation, use it as a teachable moment with your supervisor, or is the appropriate term for
attending?
Attendings, thank you. So again, just say, hey, I learned something new, and I want to practice it with you, and being able to have that conversation. Also, use your resources. I'm a resource. Barbara in HR is a resource. Rebecca, Dr. Lindsay, Anna. Again, you have a community to be able to help you with not only LGBTQ plus initiatives, anything that comes around that may make you feel uncomfortable and you need some guidance. So feel free to lean into your resources. So serving LGBT patients, families of origin and or choice, and guardians. This is the bulk of what you guys do every day, and I'm so grateful for you. Becoming an ally, again, this is usually used, the term ally, when you're speaking about LGBT, but ally can be for any group that you're not a part of, but you choose to support and stand with. So the levels of acceptance that are traditionally put out there for becoming an ally is repugnancy, tolerance, acceptance, and affirmation. And again, this can be cyclical. Again, the way you learn is by asking questions, educating yourself, and being open. Specific language to monitor. The one that sticks out to me is sex assigned at birth. So again, we're going back to the chromosomal, anatomical portions of a person. Gender is not assigned at birth. So going back to those adjectives and descriptors that we use, those can apply to everyone, and that gender cannot be applied because that is an individual choice. And Intersectionality. Has anybody heard of intersectionality? So that's usually the concept that we bring our whole selves wherever we are. So I am standing before you as a director of inclusion and diversity, but I can't divorce the fact that I'm a mom, I'm a wife, I'm a friend. I bring all that with me every single day in everything that I do, and that shapes how I interact with and around the people that I am encountering in the world that I encounter. So one example was from, again, another PFLAG meeting, was a young woman stood, well, she didn't stand up. She identified herself as a 16-year-old disabled lesbian Muslim from Brazil. So think about all those intersectionalities that came with that one person. So she could be in certain minority groups of ageism, ableism, homophobia, Islamophobia, racism, and sexism. Again, but she's a 16-year-old girl. But she has all of these different layers to her that shapes who she is and how she interacts with the world. So again, we need to be very aware that a patient may come presenting one thing, but there are layers and levels to everything that comes with that kiddo. Positive impacts of outness, again, it's not just with our LGBTQ folks, it's also with everyone. We should be able to live the life to the fullest that we are allowed to, and being able to be who we are wherever we are. Oops. And for the sake of time, I'm going to end here. This is from an article from 2014 from Santiago Cortez. He was an 18-year-old freshman at University of Pennsylvania, and he did an open mic night. And I thought that this was very helpful to end our conversation. Why do only certain letters get to be in the full acronym? We have our lesbians, our gays, bisexual, transsexual, queer, homosexual, asexual, pansexual, omnisexual, transsexual, agender, bigender, third gender, transgender, transvestite, intersexual, two-spirit, hera, polyamorous, undecided, questioning, other, but most importantly, human. So does anyone have any questions? I know this is a lot of information. It's overwhelming. Yes.
I think the whole like sex versus gender is very interesting, and the sex assigned at birth, especially like Dan said, it stood out to me when you were talking about it, because we think about the medical part. Obviously the social is important as well, but there was a baby in July that was unassigned to a transgender parent. I don't know if you guys know about this case. And was just wondering if you guys have heard, kind of being in tune with the community, is this something that's going to come up? Like, are they actually talking about there being a male, female unassigned?
I haven't heard too much about it here in Ohio. I think that case was in the state of Washington, if I remember correctly.
The one that I know of is in Canada.
Okay, okay.
I don't know if there's been others.
I'm aware of one in Washington State, that an individual gave birth to a child. The individual chose to not identify their gender and chose to raise their child in the same capacity, so that this individual child, as they grew, were able to identify what felt right for them, as opposed to saying, this is Johnny, he's going to wear football jerseys, he's going to, all the stereotypical things that we do, and let the child decide. So it did cause issue because that one was Canada. I remember this one as well, because how Canada provides universal health care, the child had to have their sex assigned at birth on their card, correct? Their medical card, or to be able to gain services as a child. And it was something that Canada, being a lot more progressive than we in the States, were battling with, because again, you want to be able to let people identify as themselves, but as far as a process, a governmental entity being able to identify an individual, they did need that information. So
there's an article that says that the baby was given a health card without a sex designation.
Oh, good to know. Good to know.
So, which is interesting. Like, if
Very
we come
much so.
across this, like,
right.
you know, I want to know what my patient is, you know.
Sure.
We have kids that are born with ambiguous genitalia, we don't know, we need to know that information.
Right. And again, it's all about how you ask for the information instead of prescribing it to someone or the family or the parents or caregivers. That's a slippery slope, and again, if we ever get into that situation here at Akron Children's, we can lean into our resources. So thank you. Oh, and I forgot to mention, there's another resource out in the greater Akron area. It's called the MEDA Center. It's run by a transgender male who is a U.S. veteran, and he speaks on his role of being a kid in Akron and not having the resources and the tools, and he is a great speaker to be able to talk about his process and how he made the transition from female to male in the military as well as with his family and friends. So I was trying to get him here today, but he was unfortunately working. So that's another resource that if you do have patients that want to talk to an individual that is an Akron kid and wants to learn more from a person who is transgender, Gio would be more than happy to speak with them.
One of the things I'm also a psychologist. I think one of the things that I've struggled with is that sometimes patients will reveal information to us that the parents may not be aware of.
Absolutely.
And so for older teenagers, I think in some cases there are resources that I can provide directly to the teen and feel comfortable with that. But I think I've struggled because I've had some younger patients where the family has been vocal about being disapproving about differences in their child. And this child hasn't even said necessarily that they're different, but I feel like one kid had the way he wanted to style his hair, and the grandfather was very hateful about it. So I've really struggled with knowing how much to push and while making sure that it's still a safe place for that child to be at home. So I don't know if you guys have any recommendations about how to navigate that, especially with kind of younger kids that might be asking questions like this or starting to realize that that they don't fit the traditional mold.
Yeah, I think that's difficult because the child can't control their environment. I don't think you would want to cause more disharmony, but I think recognizing some of the negative impacts of being in that environment and what are some coping skills that you, not agreeing or disagreeing, but hey, let's look at how do you want to look at this, how do you respond to these kinds of situations, what are some coping skills that you can help that child with to maybe even just get through it. It's my suggestion.
I agree with that because it is difficult, but again, to acknowledge anything that they share with you, that it is held within confidence, barring the legalese that I'm not very well versed in. But usually kids just need to talk, adults just need to talk and know that they have a safe person in a safe space. And that may prompt them to reach out to other safe people that identify themselves in their lives, be it, a school counselor or teacher or somebody else in the community. So again, for them to be brave enough to bring this up to you is a wonderful first step. Thank you all. I appreciate it.